is Star Right, and in this video today I will be remediating the central line dressing change. I want to have it noted that I have on no acrylic nails, I have no facial piercings, and I do have my ID badge on. It's taped, but it is on. I am going to go ahead now and proceed with my video. The first thing that I'm going to do is make sure that I perform hand hygiene upon entering the patient's room. I am then going to introduce myself to my patient and ask that my patient introduce and ID himself using two forms of identifiers such as name and date of birth. I would then go ahead and explain the procedure that I'm about to do and make sure that I close the door behind me or the curtain, letting them know that I will be performing a central line dressing change. After I've prepped my materials, I would go ahead again and perform some hand hygiene. And then I would go ahead and place on my mask. I would ask my patient if he or she cared to put a mask on. If they did not want to put a mask on, or either, I would just have them know that I need them to turn their face the opposite way of the dressing change before I begin. So again, I would perform hand hygiene. And then go ahead and put on my gloves. Okay. From here, I'm going to go ahead and begin to remove the old dressing, which I have as a band-aid here. So I'm going to just, from the corner, parallel to the skin, I'm going to pull the bandage back in a slow motion, ensuring to stabilize the catheter with my dominant hand. I would then take the old bandage and discard of that in the biohazard bag. Yeah. So then, after that's done, I would inspect the skin for any type of signs of infection, such as redness, swelling, foul odor, any type of discharge. After that, I would then go ahead and discard of my gloves, perform hand hygiene again, and prepare my sterile field. Okay, so I'm going to go ahead and open up my box. Again, this is for remediation purposes. I would then go ahead and grab out my sterile gloves. All that is in there. I'm going to go ahead and get myself a little bit of room. Still in view of the camera. Okay. I'm going to get myself some room. Get everything over. Okay. So this is me now opening up my sterile gloves. Again, let me make sure everything's still in view and I have enough room to do so. Okay. This should be okay. So I would go ahead and open up my pack. From here, I'm going to pinch the inside of the glove and assist myself in slipping that over my hand. Okay, just like that. I would then tuck my hand in the inside of this glove and slip my hand in there. Okay. From here, the next thing that I'm going to do is grab my chlorhexidine out of my sterile kit. Like I said, I've already inspected the site. I'm going to grab the chlorhexidine, go ahead and open that up, and I'm going to go ahead and do it in a back and forth motion, cleaning the area, which is the same one as the dressing. Go ahead and clean that for 30 seconds. Okay, and then I'm going to let it dry. Ensuring that that is dried. I'm then going to go ahead and get my new TSM dressing, which I don't have one. Again, this is a remediated video. I would go ahead and get a new dressing and prepare that. Okay. And we're just going to place that over the central line. Okay. Okay. This is a band-aid. Okay. So once the new dressing is set on there nicely, I'm going to make sure to put the time, date, and initials on there. After I label it, I would then go ahead and discard of all of my supplies in the biohazard bag, ensure that my area is cleaned up, check in with my patient for any adverse side effects, and then lastly, I would perform hand hygiene and leave the room. And that is the end of my remediation video. Thank you.